came off the stage at CPAC from a rousing speech on well, a number of issues, but primarily about fiscal responsibility and cutting spending. You made the point that we have Republican governors around the country that are having to make tough choices and are doing a good job of that. Chris Christie, yourself, other Republican governors are cutting spending. Seems to be a problem, a conceptual problem in Washington. I think that was the point that you were making.
Well, it is. You know, I was here as political director of the Reagan White House. I've spent a lot of my career in and out of Washington. I've never lived here. But Washington's idea of a spending cut is the department spending was supposed to go up 8%. It only went up 5%, so that's a 3% cut. Now, that literally is how the Washington Post used to define a spending cut during the Reagan administration. We can cut spending. There is not a department or agency in the federal government that cannot weather with no problem, no reduction of service, a small spending cut. And a lot of them can take a big spending cut. I cut spending in my state, as I'm allowed to do under state law, 9.4% in 1 year. And I will tell you, hardly anybody even noticed. Now, that's just the truth, and the American people know that, and that's why they are mystified when Washington has a hard time finding spending cuts.
Governor, one of the issues about spending cuts, electorally speaking, is that it's hard to, or at least this has been the conventional wisdom, it's hard to run by saying no to people. To say, it's always easier to run for office by saying yes. Yes, we're going to spend money on this. Yes, government's going to do this. Did 2010 change that dynamic? Maybe even 2009 with Chris Christie in New Jersey and the very blunt talk about cutting back salaries, cutting back government, seems to be a way to win office, at least lately.
Ed, look, everybody who's had any time in politics understands every penny appropriated has a constituency. So if you're going to let the people who are the beneficiaries of the spending control the taxpayers' money, you may think that'll make you popular, but that is a fool's game. Yes, people are going to complain, and people are going to complain when after the spending cut they figured out, wow, that didn't hurt anything, that was fine. But people are naturally, the people who are the beneficiaries are naturally worried about it. I think we're learning the American people are ready to hear the truth and to deal with the truth. And that's what we have to have the courage to understand. Yes, those who are the constituents of the spending will whine and mope and moan, but the average American, the taxpayer, has started to recognize, and Obama has driven a lot of this, that we can't spend ourselves into prosperity. Just like you can't spend your family rich, the federal government can't spend the country rich. So I am convinced that straight talk is ready. I mean, it's time because the public's ready. The public's ready to hear the truth, and they can deal with the truth. You got to trust the public enough to tell them the truth.
When you're talking about the beneficiaries of public spending, I think I don't want to put words in your mouth, so I'm just going to ask you the question. You're speaking of the public sector unions, the government unions that tend to benefit by expanded jobs, expanded opportunities through expanded government programs and new government programs. How big of an issue is it to try to overcome the power of the public sector unions that are fighting efforts to cut back government?
That is an issue. It's not the only issue about spending, but it is a big issue. Now, you'll be pleased to hear in Mississippi, we do not allow collective bargaining by public employees. Public employees cannot strike. We do not deduct union wages from public employees' payroll checks. If they want to join a union and pay the dues, man, that's fine. That's their business. But we don't do that. So I don't have the problems that Chris Christie's got or that Mitch Daniels has dealt with or that others. But that is a big issue, and the American people have come to understand that where there was once a day that the public employees were paid low salaries, and because of that we gave them really rich pension plans because they didn't make much money. Today they make far more than the average citizen of the state, and then they have these super sweet pension plans that are very, very generous. But the American people also now understand we can't afford to pay for that. that the taxpayers, including the union taxpayers, the private sector unions, the industrial union members, are starting to understand, I am being forced to pay for way more than is right. But when I talk about, let's don't kid ourselves. When I talk about the beneficiaries, I'm talking about people on Medicaid. That's why I said in my speech today, we have controlled spending in Medicaid, and nobody got thrown out of the nursing homes. Hospitals didn't close. Nobody's in the street. We have a very generous Medicaid program in terms of benefits. But we're talking about people on Social Security. We're talking about people on Medicare. We're talking about the Defense Department. There is no department or agency of the federal government that cannot save money. I talked in my speech, we save about 4% compared to 10 years ago or 8 years ago on Medicaid, purely because we run the program better and we've driven the error rate down. If the federal government did that, the Medicare beneficiaries, the doctors, the providers wouldn't notice a thing, but you could reduce by about 5% the cost of Medicare just by running it right.
Entitlements really are going to be what needs to be addressed if you're going to address the federal budget deficit, because most of the deficit is coming from a large ramp up in entitlements. Does Obamacare do that? And especially, I'm really interested to hear what Obamacare does to you at the state level through Medicaid. I mean, you just got done saying that you've managed the Medicaid program very well in Mississippi. You've lowered cost in Medicaid without costing people coverage or care. Does Obamacare actually address the entitlement issue as the Obama administration suggests?
Ed.
Yeah, this one was an easy question, Governor. I'm aware.
You know, more than half of federal spending is for entitlements. And you can't deal with spending and deficits and debt if you don't include entitlements. Now, the Obama administration says, well, we've got these three huge entitlements, Medicare, Medicaid, Social Security, that are more than half the budget. Now, what's the solution? Let's create another entitlement. We'll call it Obamacare, and it'll cost trillions of dollars over time. What does it do to my state? Well, it will be a huge tax on Mississippians and the voters of many, many other states. Why? Because it's going to drive up the cost of Medicaid. It's going to increase the number of people on Medicaid in Mississippi by half. By half. In the 10th year of the program, remember, they backloaded the spending and front-loaded the revenue. We don't spend anything for like the first 4 years, but in the 10th year, it'll cost us $443 million.
Just in Mississippi?
Just in Mississippi. That is a 9% increase in my state budget just for the expansion of Medicaid. And actually, that's lowballing it because it doesn't include the doc fix, where the federal government in a separate bill gave doctors a $250 billion increase in their spending against the baseline, but they put it in another bill so it didn't count. That's the kind of phony numbers gaming that we have to deal with.
Up until now, entitlement spending has been considered the third rail of American politics. Nobody wanted to talk about Social Security reform. George Bush tried to talk about Social Security reform in 2005 when it may have been easier to accomplish. He ended up paying a big political price for it. Do you think that the American public has matured in the sense that now we can have an honest discussion of entitlements and perhaps revamping those programs so that they make more sense?
Well, the good news is with entitlements, you don't have to make gigantic changes. It is incredible the effect of relatively small adjustments. As I mentioned earlier, my Medicaid program, just by reducing the error rate, just by making sure everybody receiving the program was actually eligible, we've had reforms that the beneficiary hardly even notices. Most of them don't notice at all. Same thing's true about Social Security. You can make adjustments in the cost of living increase to go from being from being wage-based to cost-based. There are a lot of things that the public would not be harmed at all but the savings are phenomenally big because the programs are so gigantic. I had a conversation with the leadership of the House Energy and Commerce Committee yesterday. What does Medicaid spending go up every year? About 8 or 10%, according to their healthcare chief of staff. I said, suppose we would say, give us a 2% annual increase, cap it at that, but give us the flexibility to run the program. Take all the federal rules off of us, let us run the program. Most governors would take that in a heartbeat. So, do I believe the American people are ready to speak honestly about entitlements? Yes, sir, I do. If I'm wrong, then we're going to be in a far deeper hole when we try to get out of it. You know, at Yazoo High, they taught us, when you're in a hole, quit digging. And if we don't deal with entitlements, we will not have quit digging.
Governor Haley Barbour, thank you so much for meeting with us today.
Great to see you.
We'll be back with more from Hot Air and Town Hall.